The World Health Organization Director General Tedros Adhanom Ghebreyesus has warned that the world is on the brink of catastrophic moral failure when it comes to sharing COVID-19 vaccines. Tedros is urging countries and manufacturers to spread doses more fairly around the world, saying the prospects for equitable distribution were at serious risk. He gave the example that more than 39 million vaccine doses have been administered in 49 higher-income countries, whereas just 25 doses had been given in one poor country. The global scramble for shots has intensified as more infectious variants circulate.
I need to be blunt. The world is on the brink of a catastrophic moral failure. And the price of this failure will be paid with lives and livelihoods in the world's poorest countries. Even as they speak the language of equitable access, some countries and companies continue to prioritize bilateral deals, going around COVAX, driving up prices, and attempting to jump to the front of the queue. This is wrong. 44 bilateral deals were signed last year, and at least 12 have already been signed this year. Not only does this me-first approach leave the world's poorest and most vulnerable people at risk, it's also self-defeating. Ultimately, these actions will only prolong the pandemic, prolong our pain. The restrictions needed to contain it, and human and economic suffering.
Well, to shed more light on the vaccine distribution dilemma, we're now joined from Addis Ababa by Dr. Ahmed Ogwell, the Deputy Director at the Africa CDC, who joins us via Zoom. Doctor, the World Health Organization is already saying that prospects for the equitable distribution of vaccines are at serious risk. In your view, where is Africa in this global scramble for shots?
Thank you for having me. Africa has not yet received any significant amounts of the vaccines that have received emergency use authorization. And as Africa CDC and the Africa Union, under the leadership of the chairperson of the Africa Union, His Excellency Cyril Ramaphosa, we have been engaging with vaccine manufacturers, and so far we have secured 270 million doses that are going to be distributed across the continent so that vaccination can be able to start sometime in March. But in as far as the global trends are concerned, for sure, it is not a very good state of affairs that Africa has not yet received vaccines for COVID-19. It is a skewed situation that needs to be corrected, and needs to be corrected urgently, because wherever COVID is, the whole globe will still be at risk.
Absolutely. Now, you did mention, of course, that the African Union has procured 270 million doses of vaccines, but many countries are hoping to get a piece of that pie. Just Nigeria, as an example, is requesting 10 million COVID vaccines from the African Union, as well as several other countries doing the same. So how does the body then plan to ensure equitable distribution on the continent of those vaccines, particularly in reaching the most vulnerable people on the continent?
We are looking at this in two stages. The first stage is actually acquiring the vaccines, which we are continuing to do. And part of the first stage is a distribution plan to each and every one of our 55 member states. The formula we are using is really very simple. We are using population because to reach herd immunity, our aim as Africa CDC is to reach 60% of the population on the continent. So each country needs to vaccinate at least 60%. So we're using population to be able to make the distribution, and then each country will then be getting those amounts that we have calculated as the vaccines arrive. For countries that are asking, we have the requests, and we are going to facilitate them getting these vaccines as soon as we receive the go-ahead from the manufacturers. Each country will get an equitable amount, and that is what we are pushing for globally as well, not just in Africa.
We are seeing some countries going the route of making their own bilateral agreements directly with manufacturers. How does the Africa CDC feel about this, particularly since there are now new variants of the coronavirus emerging?
First, the issue of variants, although it is clear that the new variants are more transmissible, there is still no evidence that they will escape the current vaccines that have received emergency use authorization. Secondly is countries in Africa are sovereign, and they can be able to make their own direct arrangements. What we are saying as Africa CDC is that we want to be sure that any vaccine that is being delivered onto this continent is of good quality, it is safe, and it is efficacious. In this way, each and every vaccination, each and every dose will count towards keeping Africa safer. We are encouraging all member states of the Africa Union to go through the established process with the Africa CDC so that we are sure that what we are receiving is a good vaccine and is going to make us a big impact in as far as bringing down the COVID-19 numbers on the continent are concerned. But each member state, of course, as a sovereign nation, can be able to make its own arrangements. What we are encouraging them to do is to ensure that they are following a process that is going to ensure safety and efficacy of the vaccine.
Dr. Ahmed Ogwell, thank you so much for your time. The Deputy Director of the Africa CDC, there joining us via Zoom from Addis Ababa.